Hi, this is Deanna Dewell, owner of Heal in Motion, and you're watching another one of my YouTube series, Heal Yourself. This one is You Need This. So I am going to talk about, sorry about the cat, about some knee rehab. If you look up knee rehab on the internet, you're going to see a number of rehab exercises. And the key is that a skilled physical therapist will be able to tell you what your issue is. You can generally strengthen your legs, right? We all have pretty much the same muscles, but there's all different reasons for why maybe one muscle may be needing more strength than another for you. One structure might be more tight than another for you. And the knee is quite complex. I mean, it's a hinge joint modified by a little bit of meniscus in there, so meaning it doesn't just bend and straighten like your elbow does. It also has this little bit of torque that it can do. But generally, what is coming from the foot up is affecting your knee, and what is coming from your body down is affecting your knee. So the strength in your hips, that's displaces the weight of your torso onto your knee. And the source of what is coming up from your foot or your ankle into your knee is the other side of it, right? So if my feet are torqued in or a little bit in, then that's going to affect my knee, or vice versa, or one versus another. And likewise, if my displacement of weight from here is weak on one side, or I'm tilted for some other reason, scoliosis or whatever, there's a lot of reasons why the knee is going to get something different on the right than the left, and something different of, you know, Bobby versus Susie, okay? So the best bet you have is getting into a skilled physical therapist and having that person guide you as to what your strengths and your weaknesses are, and what structures might either be damaged or at risk. And if you've just come out or just going to go into a knee replacement surgery, it's just as the same, right? Because what you did before the knee surgery or what you're going to do after, they're different for each person. You know, were you a runner? Were you a desk job? Were you know, what kind of activities did you make your knee go through? So we're going to go through a bit of the basic strengthening of your knee. I just did a Stairway to Heaven, and I realized that for some people that could have been Stairway to Hell, that exercise. So it was an exercise planned for people that don't particularly have knee pain but want to do knee strengthening. And I thought, let me counter that with a little bit of those of you that do have knee pain. So again, your best bet is to get assessment from a PT, but we are going to work on quad strengthening. Right? Your quad is 4 muscles here. They're all attached to the patellar tendon. So patellar is my kneecap, and it is housed inside a tendon, which actually attaches down underneath here, right? And the quad has 4 muscles in it, hence the name quad. So if, per se, my inner quad here, vastus medialis, is too strong, and this is weak, then I would have an imbalance there where the patella tendon would ride might be tighter on one side than another. So strength or tightness can shift it one way or another. Most people tend to be a little bit weaker in this one, and we tend to be pretty tight out here in this iliotibial band, okay? Sometimes the iliotibial band is extra tight because your glute muscle here, the glute medius, is not quite as strong. So let's start with the quads. Generally, a nice simple way of doing a quad exercise is you're sitting in a chair and you extend your foot out, right? And you squeeze your quad. Now, if I want to add resistance to that, I could put a little weight, an ankle weight on my ankle, right? Because I'm in gravity. If I'm in the water, I could point my toe and have the force of the water against me. If I wanted to add a band, I could add a band to that exercise, right? Let me go one more step. No, I think I'm going to stay there. One more. So if I'm going straight out in front of me, I'm working, you know, whatever I have there, but I can change it a little bit. I can work a little here on that VMO if I tilt my foot out, okay? And I can work a little bit here on the vastus lateralis if I tilt my foot in. There's 2 in the middle, okay? Intermedius and rectus femoris, okay? So that's why there's 4. 2 in the middle, 1 on the outside, 1 on the inside. So that's working my quad. Now what's on the opposite side of the quad is the hamstring, okay? That's the opposite muscle, an opposite action. So it's going to be here when I lift my foot toward my behind, right? Again, I can just lift this foot up to strengthen this, right? If I have a standing position while I'm doing this, it's going to be against gravity from the moment it leaves the floor. If I'm laying on my tummy, can you see how there might only be one moment of gravity up to 90 degrees? The rest of that, if I'm laying on my tummy, would not be gravity. So it could be a little bit easier for someone. If you want to add a little resistance, you do this. Now my gastroc is also attached at the knee, so if I point my toe, I'll be taking a little bit of that out. If I flex this, I'm using this muscle to help lift my knee, lift my foot instead of the hamstring. So pointing the toe is good. And also there is a tendency to use the hip flexion, right? Then I've totally taken away any of that hamstring work. So make sure your thighs stay parallel to one another as you work that hamstring. Same sort of thing. So I'm going to turn around this way. I have a few different fibers to that hamstring. So I tend to be a little strong this way. This is my tendency, right? So I'm going to be strengthening this one. If I go out to this side, I'll strengthen something different, right? So you might watch the angles and go against your tendency, right? I'm trying not to tilt my hips. I'm trying to just tilt my leg in the socket. You know, I'm going to feel that, of course, in my hips. So some of you that have had arthritis, that's going to be felt in the hip more than anything else. Okay, all those exercises can be done laying down flat on your tummy too. Okay, that might be a nice way to counter if you have balance or if you're not quite strong enough to do it with resistance. Okay, so we did the hamstring, we did the quad, varied the angles by varying where it is in the hip socket. Okay, let's travel a little further down. We're going to go to the calf, right? We have calf raises, but if you're not quite up to that because it's quite difficult to do the whole body, you can simply have something you're pointing. So I have a little band. It could be a karate strap, something that's not so flexible. And I'm using it on the ball of my foot pointing. Now, if you've ever done your calf series with me, I ask people to do parallel feet, duck feet, and pigeon toe to try to get all around the calf. So again, you can change those angles, right? Now, it's not going to be in the hip. My kneecap is still shining toward the ceiling, but I've turned my toe in. I've turned my toe in for this exercise, even though my kneecap is still facing the ceiling, and out. So this is duck foot, this is pigeon toe, okay? Make sure you don't turn the whole leg because otherwise we've changed what you're doing. It's going to be more in the quad. Okay, so then you've got your calf. You've done it, okay? We've got one more, the glute medius, right? That has to do with where your hip lines up. Okay, so even if you had a knee surgery and you think, oh, I just need to rehab the knee, you've got to rehab this hip as well because it controls where the knee will land every time you take a step. So some of the easiest ways is simply lifting that leg out to the side. Okay, I don't have any resistance on it. Sometimes this is hard enough for a person. From the front, it would look like this, trying to keep my hips stable and just sending my foot out. You can add that resistance to the ankles. You could add an ankle weight, or you could lay on your side. So if you were laying on your side and you did the same action, you just have to try to moderate your hips so they do not move. Okay, but then you'd have gravity against you. So those are a few different ways. If you want no gravity against you, imagine lying on your back and doing it this way, right? Lying on your back and doing it that way. That way you only have the resistance of your heel or whatever is touching the bed or the floor, right? That friction. That's a nice way to just get an introduction to it. It's called zero gravity. Okay, I'm just going to check my little list, make sure I've got everything. Okay, the last thing I want to talk about is the glute maximus here for strengthening. Okay, some ways in standing, I have to hinge forward because otherwise I wouldn't get quite what I need. I'll get back extension here. If I send it back and I arch my back, I've got a little microphone case here, but this is back extension. That's not what we're trying for. So hinging forward, sending the leg back. And I'm not going very far because I have a little banister behind me. But in essence, sending that leg back, squeezing the glute max. Okay, that's one way to get the glute max. Different than the glute medius, which is this little circular, it's actually a triangular muscle. You could also lay on your tummy. I would suggest laying on a pillow so that you have a little curvature here and do the same sort of thing, lifting that leg up straight toward the back, right? Laying on your tummy. That's not always comfortable for people, so some people like to bridge, right? That's when you're laying on your back, okay? And you're lifting your bottom up, okay? high, laying on your back, lifting your bottom up, bridging. Using that kind of tilt of your pelvis to really utilize your glutes and not your back muscles. It's tempting to do the same motion with your back muscles, back extensors. Okay, so besides rehabbing the muscle strength, you are looking at the range of motion, okay? The range of motion is generally bending and extending. So bending the knee post-rehab or even pre-rehab, because you might have a structure in there, such as osteoarthritis, that is preventing you from fully bending it in, okay? There's a certain point where it's just not going to be healthy for you to push your range, something that PTs call hard end feel. When there's a hard end feel, it means two bones or two hard structures, it could be a hard bit of cartilage or something, is hitting one another, and you're not going to do any good by pushing past that hard end feel. But if it's a soft end feel, it means it's a flexible structure that you can push a little further. Pain can cause a reaction. You can breathe fast, you can stop yourself from really having a stretch, so make sure you relax through that or stop if you're having too much pain. It can also inflame you. So going and bending, I can pull this back with a little rope. Let me use my little thing here. So if this were non-flexible, I can pull this back. Say I'm sitting in a chair and those feet are down underneath me, and I can pull this back to get a little bit more range, okay? Likewise, when I'm in that chair, if I put my foot up on something, I can extend the knee back, right? Pushing the knee down. Now, I've seen many, many knees that do not want to go straight, okay? Strengthening it can be one of your benefits, right? So let's say you have to push into a ball. So I'm straightening it to get the quads here strong, but I'm also trying to get a little more range. So here is a quad strengthener while I straighten my knee, okay? If you wanted to straighten your knee more, you let it hang empty, right? So say my range is about here, and I need to make it a little more, pushing down to get the back of that knee down. Sorry about the cat, I do have a house full of animals. So pushing the back of the knee down. Okay, and that's because my foot is elevated and the back of my knee is free. Now I can still do a nice quad set. I can even change the angles like we talked about. Change the angle of my thigh and the socket. Okay, to try to get a little bit of different parts stretched out. Okay, so that was the quad getting stretched, the back of your knee getting stretched. Now when I did the quad, I was in this seated position, so that means the hip flexor is not getting stretched. So in order to get that hip flexor stretched, a nice way to get that is put the foot up and then turn yourself around. So I lifted my foot up onto a stair and then I turned myself around, okay? Some people this already will stretch quite a lot. The difference is you might have been able to get more range, right, when you pulled your foot under because you had hip flexion. Now you're in hip extension. So I encourage you to tilt your pubis bone forward. From the side view, looks like that. Tilt your pubis bone forward so that you're not arching your back. In this position, I can even lift it up, I am not getting a hip flexor stretch. I'm getting a lower back stretch, okay? So you must take care to make the joint move or stretch that you want to stretch, not letting the most flexible portion of your body, which might be back extension, do the work, okay? Stretching the hamstrings. You can put that foot up. The key is tilting your pelvis back or your tailbone out, right? That's the key to getting that hamstring. Again, you can change the angles. You can make it a little more adductor stretch or inner thigh. You can change. You can veer it out a little bit, right? You have a whole fan of muscles around this hip. So stretching around the hip from the front to the side, that would be this stretch, the seated piriformis stretch, okay? This can be done laying down on your back as well. Okay, you make your number 4 and you pull this in. So say I'm laying on my back, I grab through the keyhole and I pull this in. Okay, so stretching your whole of your hip, stretching your quad, stretching your hamstring. The last one you have to stretch is your calf. Okay, that's of course going to be letting it hang off the edge. If you can't tolerate that, maybe it hurts your knee to stand like this, You can go ahead and take that strap that you had before. I use like a leather belt when I want something that's not going to move, and pull back. Remember, we did the exercise with the band where you point, but in this situation you have something that's not flexible. Have something like a leather belt or a karate belt or something that you can pull and stretch. And that might give you a little sort of relief so that you don't have to stand on that knee if you have a lot of pain. Okay, so get an assessment from a PT if you don't know what's going on in your knee. There are many structures in there, and it's better than fishing around on the internet just to go have somebody skilled look at you. Strengthen. You can do this without any harm, right? Don't go to the point of pain, but strengthen the muscles. The quad, all angles, the hamstring, all angles, the calf, and the glute. Think of kind of like you're spreading some oil, some strength or something. So you're gonna get all of the areas of the glute that you can get. There's 3 of them on each side. Then stretch those same areas, okay? So I'm hoping that your stairway to heaven will never ever be a stairway to hell. Try to do the workouts without pain. And if they cause pain, then figure out what the issue is and strengthen or lengthen what you need to have done for yourself. Okay, thanks so much. See you next time.